The clock ticked towards 7 a.m. on a Wednesday morning, not in a hushed courtroom but in the bustling hallways of a hospital, a place usually dedicated to the urgent rhythm of life and death. Yet at this precise moment an entirely different kind of transition was underway. This wasn't about a patient leaving ICU or a new life entering the world. This was about ownership, control and the very fabric of public health in New South Wales. At that exact hour a piece of paper changed hands, and with it the fate of an entire hospital, a sprawling, modern facility on Sydney's northern beaches, shifted from private hands back into the public system, marking the end of a partnership that had for years been nothing short of a running national saga. Imagine the sense of quiet triumph for those who had campaigned tirelessly, or the gnawing uncertainty for the staff who had worked under two very different masters. This was a moment years in the making, the culmination of a deeply troubled experiment and a stark reminder that even the most well-intentioned deals can unravel, leaving the community to pick up the pieces. For 8 long years the Northern Beaches Hospital had been a symbol both of ambitious innovation and profound frustration. Nestled in French's Forest, a leafy suburb of Sydney, it was meant to be the best of both worlds, a state-of-the-art facility delivered and operated by a private company, Healthscope, yet serving the public health needs of a rapidly growing population. The idea was simple enough on paper: leverage private sector efficiency and capital to build and manage a major hospital, freeing up government resources while still providing essential public services. This region of Sydney, stretching from Manly to Palm Beach, had long felt the squeeze of inadequate health infrastructure. Its residents, many of whom worked hard, paid their taxes and expected a fair go when it came to healthcare, had been promised a shining new facility that would seamlessly blend public and private care. They were tradespeople living in Narrabeen, professionals commuting from freshwater, young families settling in DY. They were the everyday Australians relying on Medicare, holding private health insurance, or often both. They believed in the promise of universal healthcare but also understood the pressures on the public purse. This hospital, with its 488 beds, 14 operating theatres and 50 emergency department bays, was supposed to be their solution. A beacon of modern medical care delivered with a private touch. But from almost the moment its doors opened in October 2018, that promise began to curdle. The incidents began almost immediately. Within months of opening, reports started to surface, and then cascade, through the media, detailing a litany of concerns that chipped away at public confidence. There were claims of critical staff shortages, particularly amongst nurses, leading to fears about patient safety. Emergency department wait times reportedly blew out, contradicting the very notion of efficient private operation. Doctors spoke anonymously of a lack of essential equipment and resources, forcing them to transfer patients to other hospitals for procedures that should have been routine. We heard stories of patients being left for extended periods in corridors or waiting days for surgery that had been deemed urgent. The narrative wasn't just about inconvenience, it was about genuine concern for patient welfare. Then came the financial questions. Reports emerged that Healthscope was struggling to meet its contractual obligations, leading to a complex web of negotiations with the New South Wales government. The initial agreement, a 20-year contract worth billions, had stipulated certain performance metrics and service levels. But when those metrics weren't met or the quality of care fell short of expectations, a crisis of confidence grew. This wasn't just a disgruntled customer complaining to Consumer Affairs Victoria about a faulty washing machine. This was about life and death. About the fundamental right to accessible quality healthcare that Australians hold so dear. Underpinned by Medicare and the broader public health system. It was about whether a public-private partnership, a model increasingly used across various infrastructure projects, could truly deliver on its promise when the stakes were this high. Could the pursuit of profit truly align with the imperative of patient care? The battle then wasn't fought in a formal courtroom in the traditional sense, but across negotiation tables, in the glare of the media, and ultimately in the court of public opinion. The New South Wales government, under increasing pressure from the community and health advocacy groups, found itself in a delicate and expensive dance with Healthscope. This wasn't a case for VCAT or NCAT, it was a high-stakes commercial and public policy dispute. The core legal argument, though rarely articulated in court, revolved around the fundamental terms of the public-private partnership agreement. Had Healthscope met its contractual obligations to provide a certain level of service and quality of care? The government's position, increasingly firm, was that they had not, or at least not consistently enough to justify the continuation of the arrangement. Healthscope, on the other hand, would have argued the complexities of operating a new large-scale facility, perhaps pointing to staffing challenges exacerbated by broader industry issues or the unforeseen demands of a growing population. Evidence presented, though not in formal discovery, would have been performance reports, patient outcome data, staff complaint logs, and crucially the mounting public outcry. The stakes were enormous for the government. It was about maintaining public trust and ensuring essential health services for Healthscope. It was about a multi-billion-dollar contract and their corporate reputation. The public, the people of the Northern Beaches, were the silent jury demanding a fair go and better care. The negotiations were protracted, complex, and behind closed doors, but the whispers of discontent within the hospital walls and the pleas from patients and staff echoed loud enough for all to hear. What would it take to untangle such a complex, financially entangled beast? The resolution came not with a judge's gavel, but with a government announcement that reverberated across the state. After years of negotiation, scrutiny, and public pressure, the New South Wales government confirmed that it would take full control of the Northern Beaches Hospital. The legal handover from Healthscope to New South Wales Health officially occurred at 7 a.m. on that Wednesday, signifying the end of the troubled public-private partnership. This wasn't a simple walk-in, walk-out. It involved intricate legal work to transfer assets, staff, and ongoing contracts. While the exact financial terms of the buyout were not immediately disclosed, it was undoubtedly a significant sum, representing the cost of disentangling a multi-billion-dollar agreement that had gone awry. For the public, it was framed as a victory, a necessary step to bring the hospital back into the fold of the public health system, ensuring it operates with patient care, not profit, as its primary driver. For Healthscope, it meant exiting a difficult agreement, potentially at a cost, but also freeing them from a contract that had generated persistent negative publicity. Was justice served in the sense that the community's demands for better, more reliable public healthcare were finally met? Many would say yes. But it also highlighted the immense cost and complexity of rectifying a flawed public-private model. It was a compromise, certainly, but one that prioritized the welfare of thousands of Australians living in Sydney's Northern Beaches. So what does this saga mean for everyday